This is ABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I hope you're well and planning for a warm weekend. Finally, after what a winter. We're here with a lot of health news, cancer news, how to live better, how to learn from other people. Sometimes they do it right. Sometimes they do it wrong. And we'll dissect some cases today, go through some news today. We're taking your calls today. We're live at WABC Studios in the heart of New York. We're just a few blocks away from our office, which is Radiosurgery New York. I'm a cancer doctor, and we take care of cancer patients. We take care of people with cancer. And we take care of people, sometimes they come to us immediately because they've heard about us or their friends have told them about us. And sometimes they're just fed up with a lot of stuff that's going around, and they want a fresh second opinion. So if you want to talk today, you're welcome to call in. We're at 1-800-848-9222, 800-848-9222. That's a direct line to the WABC studio, and we'll be happy to take your questions or comments or whatever you have to say, almost whatever you have to say. Haha, I knew what you were thinking. We have good news today and more news, so we're going to jump right in today. The first case was an interesting case. It's a man who came to us. He's from Egypt. He's an American now. He's about 40 years old. He's very athletic, big muscles, and handsome guy. And yet, about 3 years ago, he had a pituitary tumor that was strangling his nerves to see. It was taking away his vision. And so he went to the eye doctor, who's actually a surgeon, and he was referred to a neurosurgeon when they found a pituitary tumor. The pituitary gland is a gland where usually the tumors are benign. They're not very commonly cancer. Sometimes cancers do spread to the pituitary, called metastasis. Metastasis is a word for a spread of cancer. But most tumors in the pituitary are benign. So he had a benign pituitary tumor. He was treated with surgery. They opened up his head and removed the tumor, or at least part of the tumor. And then he went, this is all elsewhere, of course, and I'm not a surgeon in general, other than we treat prostate cancer with seed implantation and the other kinds of cancer like that. So he had surgery, and he was doing okay, plugging along, and then he went to a facility to get MRI scans of his brain. And for the last 3 years, he's been getting scans, and the scans were A-okay, everything's okay. And then finally, he gets a scan in January this year, and in January it shows the tumor is growing. So he comes to us, he heard about us, and had already gone to his own doctors, and he was upset, why is it growing now, what was seen before? So we got all the scans and reviewed them, and actually, when we reviewed the scans, it had been growing all along. Just the radiologist probably didn't speak to the surgeon. When patients come to us, you usually will hear a conversation between the radiologist and the doctor, and you'll be able to ask questions after I get a good idea of what's going on, with the doctor actually looking again at the scans and confirming again what a person has. Then I'll turn to the patient, maybe you, and say, do you have any questions for the radiologist? Is that what happens with your doctor? So he was upset, this man, and found his tumor was growing. Of course, a neurosurgeon wants to operate again. Now, what would make it better the second time, the surgery, than the first time? The second time, it's not a pristine pituitary anymore. It's a operated field, which means it's changed. The treatment, when it was easier, didn't work with surgery. So why would this fellow want surgery the second time? To me, it really didn't make sense. He came to us. We, of course, offered him all the options, which I do for all the patients, because I think when you have better treatment, you can offer all the options, and people run away from surgery and chemo and other stuff in general. That's the advantage of having the better treatment, and I believe often we have the better treatment. I won't say it's always, because it's never, nothing in medicine is always or never, but I'm talking about generally. So we treated this gentleman, and he just actually finished on Monday his course of focused beam treatment just to hit the tumor. And he came in yesterday, Friday. He came in with a new scan. And so what did I do? Well, I did what I always do. I got on the phone and spoke to the radiologist. And before I spoke to the radiologist, the patient said, well, what do you think you're going to see? And I said, well, we just finished the treatment on Monday, and now it's Friday. I said, most likely it's going to be about the same. This is a treatment that works, hopefully, for the rest of your life, not just Monday, Tuesday, Wednesday, Thursday, Friday. And we got the scan back, and the tumor already shrank. Wow. It went from 1.44 centimeters down to 1.34 centimeters. This is just 4 days after the treatment. Wow. I was happy. I think the patient was shocked and happy. In fact, he wrote me an email later in the night inviting me for dinner. So I think he's happy. I'm happy. And that's the kind of work that we do. We confirm what you have. We have you participate in what you have. You get copies of your reports. I mean, so often patients come in the office and they don't even have papers of what they have. They don't know if the tumor is bigger or smaller, where it is, what kind of tumor. Many people, shockingly, don't even know what kind of tumor they have. I had a patient this week, didn't even know what kind of lymphoma she had. So we like to educate the patient. The patient has that right. Maybe they're not used to it. Maybe they're not used to dealing with a doctor that includes them in on the conversations with the radiologist, that includes them in on the documents. But we try to practice in a better way. And when the better way means more involvement in your case, you can see how it improves your chances. You're involved. You can research it yourself. We're not shy. You can go anywhere you want in the world. It's a free country. And when you have a tumor or cancer, whatever, you, the patient, are the president of the United States, of your body, and you make the decisions. We, the doctors, are the advisors. We're not the president of the United States of your body. You are. So for this gentleman who was being pushed to have a second surgery when the first surgery didn't work, it really didn't make sense. Most likely it wouldn't have worked. We avoided the big operation, opening up his head, someone's hands in his head. And then he probably would have been back to us when the surgeon said, whoops, I just couldn't get it all. So that wouldn't have helped the patient. It would have hurt the patient. So it's symbolic. It's the good news department. For this gentleman, it's good news day. He's so happy. He had great results. He'll be back in 3 months. He's back to work. Actually, he worked throughout the treatment. That's the beauty of our treatment compared to neurosurgery, where he gets laid up and incapacitated. No, with us, he was working every day. Working every day, feeling well, doing great. And speaking in the good news department, well, here's a gentleman, very interesting gentleman, who presented with metastatic stage 4 rectal cancer 1 year ago. So in February 2013, 1 year ago, he came to me with intractable pain. He couldn't sit down. He couldn't lie down. He couldn't do anything. He had had standard radiation. He'd had standard chemo. He'd had standard surgery. Nothing worked. He was on high doses of narcotics. Nothing worked. He heard about us. He came to us. He brought his case to us. I thought it was a great case for us. I thought it was a difficult case for us because he had had extensive prior chemo, radiation, and surgery. This cancer in the abdominal and the back of the abdomen by the nerves and spine was massive. He was being pushed by his doctors to go on hospice, which is end-of-life care, which is great for some people. Everything is great if you want it. But if you don't want it, it's not so great. He wasn't ready to go and die. And that's where his doctors and his insurance company actually were leading him. I called his insurance company repeatedly, and they said, just put him on hospice. Put him on hospice. And I said, but I think we can help him. And the patient wanted to be helped. The patient wanted to get out of pain. And finally, after a month of back and forth with the insurance company, we treated him. We treated him more than a year ago to his cancer, and his pain went away. And it's been 1 year, and he's had no chemo, and he's had no other radiation or surgery, just that 5 treatments of focused beam radiosurgery, which we pioneered. The pain went away. He's had a great year. And he walked in my office yesterday, and suddenly I remembered everything that took place a year ago, more than a year ago, for us fighting for this man and the insurance panels. And sometimes with this man, I was thinking about Sarah Palin when she said there's going to be death panels. And this man, in a way, there were. It was fight and fight and fight to get treatment. And that was what the patient wanted. And that's what I thought was best. And it worked out. A great year. He's back. We're getting checkup. We'll report back to you. But the good news is 5 treatments. He had a great year. No chemo, no radiation, no surgery, just 5 radiosurgery treatments. Wow. What a difference a day makes. Wow. If you have questions, please call us. We're at the WABC studios. We're live. We're going to hear from our sponsor. Our number, if you want to call us, is 800-848-9222, 800-848-9222. We have some new voices to tell you about radiosurgery and Dr. Lederman.
For cancer treatment, most prefer effective, non-invasive, well-tolerated